Hi, everyone. Welcome back to our expert series for Sense of Self. Today I have with me Dr. Micaela Owusu, who I call Mimi, but who's a child, adolescent, and adult psychiatrist who currently works as a psychiatrist at a prestigious university, working with undergrad and graduate students dealing with a range of mental health issues. She also has a private practice where she sees private patients, and we're so happy to have her here today. She works kind of at the intersection of mental health, identity, belonging, and culture, which is exactly kind of what Sense of Self is all about. So welcome, Mimi. Thanks for being here.
Thanks for having me.
Of course. And so today you're here to discuss our, I think, second episode, Dr. Joy Melody Woods Bennett, who talked to me a lot about her childhood growing up in the South in a very kind of strict religious family, how she sort of made a move out of Texas, which is really a big deal for her, and how she landed in university, where she just, where she discovered where she actually received, two diagnoses from a mental health professional that she was fully unaware of having, both a learning disorder and bipolar disorder type 2. And she discusses sort of how she navigates those diagnoses, let alone, how she initially went for help. And so I think, although Joy talks about a lot, one of the reasons I was hoping to have, you on the podcast series is because you have so many different expertise. You have a history in global health. You have a history of being you're a wonderful psychotherapist, and you happen to also be this expert in now college mental health. And I was just curious. We've noticed that her story, specifically about the diagnosis and how she moved through it, resonated with a lot of people. And I'm just curious, kind of why you feel like that story has resonated as much as it did.
Is just negotiating a new diagnosis as a young adult and really sort of reflecting back on the past and thinking, I wish I'd known this sooner. What does this mean about who I am, who I thought I was? And how that also interacts with identity development. There's the identity as someone with a new diagnosis, but she also had spoken about racial development. She talked about just the transition to being a young person in college, leaving a cultural environment that she had grown up in. And so when those two things interact with each other, I think can be really interesting. And the last piece is navigating the expectations that her family had for who she was supposed to be and how identity development and negotiating that new diagnosis sort of conflicted or did not conflict with those expectations from family. So I think her story really encapsulates a lot of things that I see in patients that I work with in student mental health who are all navigating that same interplay, which can be particularly present, I think, in people from marginalized cultures.
Yeah, I'm so glad I'm so glad you said what you said, because I think you are essentially getting at the fact that it can be so different for each person based on how they grew up, what their context was, how, and I think reckoning with all of that at a developmentally very, I want to say fragile stage, because there's a huge transition, especially if you're in university far away from home, if it's a different culture than what you're used to, it can be a very vulnerable time. And so to kind of deal with a diagnosis that can really shift your, for lack of a better word, sense of self, is a multifactorial intersectional issue. And I'm so glad that the students where you work have you, because I oftentimes think that intersectionality, that multifactorial nature of this is often lost in the interactions. I know when I was a student at university and I kind of went into for mental health services, there was no sense of that. No one ever took my background into, consideration. There were a lot of stereotypes that were provided, you know what I mean? Or that were kind of laid on me personally. And I think very eye-opening to sort of realize that, the way I grew up, my family, what they expected of me, how they labeled me, what my role was with them, all played a role into why, certain diagnoses could be so soul-crushing. And, right. And so I'm just curious for you, do you have an example perhaps of something you've seen in your work? We talked about Joy a little bit, but I think what's really interesting here is how this is very universal. I'm just curious if you could share maybe an example.
Oh gosh, I have so many examples. I'm wondering, I'm sort of thinking in my head, maybe I can conflate a bunch of stories and give you
That's
sort of
what we always do, right?
a classic sort of case.
Yeah, give us like a hypothetical.
Yeah, so I would say a fairly classic case that I see, and I work at a school where a lot of people are not necessarily from the area. So a lot of people are moving far from home. I would say maybe there's a first generation student who's coming to the state for the very first time. Maybe they are from an ethnic background and a socioeconomic background that has not historically been served by the type of university that I go to. So coming in, they're already feeling a little bit like they're not maybe supposed to be there. I think there's a lot of stereotype threats that can come about from that. If I don't do well, maybe, I wasn't supposed to be here in the first place. I think a lot of imposter syndrome. And oftentimes what will happen is that maybe this is a student who was really excelling back home academically. Their level of intelligence was just maybe exceeding the capacity for their school to meet them at the challenge that they really needed. And then they come into an environment like the one that I work in, and suddenly they find that they're really struggling to keep up and they can't understand why. And that identity piece sort of makes them feel like, well, maybe I'm just dumb, which I think is something that Joy had maybe described, if I'm remembering correctly. Maybe they let me in, but they weren't supposed to let me in. But what really is happening is that their level of intelligence just allowed them to kind of excel, but really there's some sort of underlying thing that's happening. A lot of times that might be ADHD, or maybe this entire environmental shift leads them to end up with depression, which leads them to feel a little bit amotivated. They're having trouble getting to classes because it's just a struggle on a daily basis. So ultimately, I would say more often than not, these kids end up struggling to the point that someone recommends that they come see me. It's a little bit more rare that the person would bring themselves to come see me, maybe because that's not the type of background that they come from. Thinking about a challenge like this as a mental health challenge may not be something that really goes alongside the culture that they grew up in. So maybe the dean's office recommends that they come because they're struggling academically. They come, we chat. I really try to understand a little bit about their background and a little bit about what feels like the problem to them. I think medically we may conceptualize it as, this is something that we can label a disorder, but that may not be how the person experiences it. And so we sort of try to come together to understand what is the meaning of this challenge that you're having. If we think that there might be a label to it, what does that label mean to you?
Yeah.
And are there resources, once we sort of have a general understanding of what we think might be going on, that can help you succeed in this new environment?
Yeah, I mean, I think what you're getting at there as well is the through line in so much of this is identity, right?
Mm-hmm.
And it's about being able to break that down a bit. So it kind of parlays into my next question for you, which is kind of what is your approach to helping them integrate this experience into their life? I'm not using it as a diagnosis, right? I think it's like a emotional experience that they're having in this transition to school, which may or may not, as we know, meet criteria for a diagnosis, may or may not have a label. And if it does, again, there's so much variety in terms of what that label looks like. Depression can look like so many different things and can feel like so many different things. So I guess, this is probably a tough question, but, and you already started to answer it, but I would love to kind of have you share a bit more about how you conceptualize these people and how you approach starting to help them, integrate this and understand its experience so they can move forward.
Yeah, I think one of the big things is just validating all of the different components of the experience that they're having. If you're someone who's moving from far away, like it is a huge deal to leave the state, culture, time zone that you grew up in and come to a completely different place where the expectations are different. So just validating the fundamental shift that's happened in their entire world and how much of a ricochet effect that can have on one's life, on one's sort of well-being, not even related to something being sort of a disorder or a diagnosis. I think the other thing is to think about understanding of diagnoses or understanding of however one wants to conceptualize the challenge that is being had as a process that could involve grief. So really recognizing that, sometimes people may not believe that whatever's happening is happening, whether that's, failure of a class or a new diagnosis or just having challenges in general, maybe struggling to make friends. So helping people just kind of sit with the fact that, they may sometimes have several different stages of grief as they start to process this, helping people understand that, especially at a university like the one I work at, there are lots of resources that are available to them. So I'm but one resource for support, but there are many, many others. So some of them come from other places in student mental health and counseling. So for example, I lead a group for individuals who identify as LGBTQ, but a particular emphasis on intersectionality. So maybe LGBTQ, but may not have always felt safe in LGBTQ spaces for various reasons. So trying to develop community in that way. or figuring out if there are resources available to them through disability services. So if there's a learning disability, for example, their needs need to be met by the educational system. And so recognizing that it's it's on the school to provide that, and that we can direct them to a location where the school can do that for them, I think is another place in which I can guide people. Medications and therapy, I think, is just one piece of the picture, but oftentimes I'm sort of a resource support to people.
Yeah, right. I mean, like the structural aspect of it, because at the end of the day, how are you going to support someone? Like you said, as we know, medication therapy is one part of it, but then in terms of what they have available to them to help them on the day to day and to actually accommodate what they're dealing with as
Yeah.
they kind of move through it is so important, and something that requires so much advocacy. So, like, so much of your job sounds like it's also just, as much as you are diagnosing, prescribing, providing support, you're also being this strong advocate, which,
Mm-hmm.
again, I'm repeating myself, but I think these students are very lucky to have, because I don't think that's something that is universal.
Mm-hmm.
And I think we wish was universal, right?
Yeah.
And it kind of reminds me of one thing I was reflecting on from Joy's episode. What really struck me about her in our conversation was how she sort of internalized and understood, I guess, her difficulties, right? I think she mentioned how she noticed something was wrong, something must be up. She kind of self advocated, went and got this testing done, found out this stuff about herself, was like, oh my goodness. And there was something about her approach where she sort of took that as information and data with which to then move forward in a way that was more informed. Like, okay,
Mm-hmm.
so I need this support. I guess that's just what it means. And there was what sounded, at least, like this healthy distance between this diagnosis and her identity and sense of self. So it
Yeah.
didn't kind of get enmeshed, which I think worked in her favor. But I'm wondering, for students that you work with, right? It sounds like that's your approach as well, which is to help them help kind of, navigate the experience without it necessarily becoming a negative or detrimental, a mark on their, full sense of who they are, right? It's
Mm-hmm.
not who you are, it's what you're experiencing, kind of thing, right? And that does make it, that's just not a nice thing we say. I think it makes a fundamental difference in how you're able to move forward with your life. So I'm just curious what you've seen. I'll start with barriers. What do you feel like are some common barriers that students face from being able to sort of, I don't know, launch successfully or move forward successfully or in the way that they want to after having an experience, like this, whether it's depression, anxiety, ADHD, a learning disability? Obviously, it's different issues, different, concerns, but generally speaking, I'm wondering if you've noticed anything that can get in their way.
Yeah. I think stigma would be a big one. So one of the things that you're, I think, describing with Joy is that um, Joy's approach with the particular set of symptoms that Joy had were to sort of separate herself from stigma, which I think was very helpful to her in moving forward, and just sort of matter of factly saying, okay, these are the resources that I need in order to move forward, and trying to not get bogged down in that. I think for some people, the level of stigma, either because of the nature of the symptoms that they're having, or because of the people around them and how they interpret those symptoms, or the label that's placed on them and what they've heard from that label, that can be a huge barrier to, I think, not getting bogged down in it or feeling like they can use the resources. So I think if you feel a lot of shame about your diagnosis, you may be less likely to actually use the resources that are available to you. So one example I have is, for some people, it can be helpful for them to take a test in an environment that's separate from other people. But to do that is separating yourself. And so for some people, there's a lot of like stigma and shame in actually being in an environment that's separate from other people. They're unwilling to do that because it feels
Yeah.
like it's labeling themselves. On the other hand, I think there are some diagnoses, some identities that actually people really take on in a way that I think feels quite validating. So things like the diagnosis of autism for some people is like really fundamentally changes their worldview. And there's a whole movement towards reclaiming that someone is an autistic person, and that's okay. So I think it may be slightly dependent on the type of symptoms or the type of experience that someone's having, and whether that identity is actually helpful to them moving forward.
Yeah, right. Because I think I too have experienced that with patients of mine, where it's incredibly affirming for them to sort of finally understand just like the fundamental difference in how they feel like they've interacted with the world than their peers, which can be very affirming to sort of be able to say, "Hey, I'm neuroatypical," right?
Yeah.
And to differentiate between the two, because whether you are a stable mood, depressed, anxious, that the autism kind of is still a through line, right? And the
Hmm.
experience of that. And so I've noticed that as well, when there's like a fundamental type of interaction or experience you're going to have day to day, independent of your mood state. And of course, your mood state and how it shows up is impacted by that as well. So I think it's
Yeah.
so important, I think, for us as providers, let alone people, to understand that, because it can put so much into perspective. I know it's put a lot into perspective for me, for patients where I've been confused and we find out, oh yeah, wow, you're a 45-year-old adult, and we're now understanding, for example, that you have
Hmm.
autism, and this is so helpful for you, for me, and we can now approach your symptoms in your life. And I've seen people really thrive when we're able to sort of affirm that, which has been really lovely to see. So no, I'm totally
Hmm.
with you there, and I think I don't want to make it a blanket statement about the identity thing. I think but I more so in the negative route, where it
Yes.
can sort of drown you in the stigma and the shame, or prevent you from actually moving forward. It can be a defense mechanism as well sometimes, as we've seen for a lot of
Hmm.
patients, where the fear of moving forward and the fear of having to now do the things, or whether it's separate yourself, or I don't know, have some other kind of accommodation, or set reminders for yourself on your phone if you have ADHD.
Hmm.
Things like little things, behaviors that you have to do. There can be so much resistance towards those things, which is so natural. But it sounds like that's kind of what you're getting at, which is that can often be so. A lot of that resistance to it can be steeped in stigma, which
Yeah.
ends up being such a huge barrier. And on the flip side, it sounds like maybe like with Joy, for example, let alone others. And it sounds like what you're recommending is, I guess, how have you helped people sort of move past the stigma, or
Mm.
shed themselves of that stigma? Because that is such a I think important step in being able to now take the steps required to both heal and then function, or just be as you want to be in the world. So yeah, just curious.
Yeah, it's a good question. I think it may sort of partially depend on the types of symptoms that someone has. So if it's something that is more on the like autism or ADHD side of things, where it feels a little bit like um, your brain functions in this way, and
Mm,
the world, or academia in particular, in the case of a student, has these certain demands that don't quite meet the way your brain works. How are we going to navigate that? I think I approach it one way. If it's more on the sort of depression, anxiety side, that feels like, well, maybe there's a set of work or a set of treatments that we can do that might fundamentally shift the experience of having depression or anxiety, then I might manage it a different way. So I would say if it's on the depression anxiety side, I might work to just really offer up a platter of treatment options and try as best I can to answer questions around those treatments and paint a picture of what things might look like if those treatments were to work for someone, thereby hopefully helping them bridge the distance to actually accepting some sort of treatment, whether that's therapy or a medication. I think on the ADHD autism side, that also might be true depending on the symptom, but I think it might be more around an understanding of this is just how your brain works, and the expectations and the way your brain works. We just need to figure out a way to make those match to get you where you need to be. But your life does not always have to be this way. You might find a career, a future academic position that does not carry the demands in the same way that sort of
yeah.
standard academia does, that will meet your brain in the way that your brain functions.
Yeah, and I think inherent in that there is grief, right? There is like
Mm-hmm.
I think that's very unexpected for a lot of people, is that sometimes the resistance can be just a manifestation of the grief you feel or are having for the previous way that you conceptualized yourself or understood
Yeah.
yourself or experienced the world and move through the world. Because as we know, like, this is like a recurring theme here, but, any kind of loss can yield grief,
Mm.
even if that loss is just a perception,
Yeah.
right, of yourself, let alone the world. And so I think it sounds like being able to identify that, make space for that, and almost like be this like kind of radical acceptance. It sounds like, right? We often
Mm,
think about radical acceptance in terms of experiencing and accepting intense emotions. At least clinically, that's how we were often taught it. But I think there's application here where there's just generally the radical acceptance for what you are dealing with, the way
hmm
your brain works, what you're struggling with, in order to kind of live a life that feels hopefully more at ease, right?
hmm
And not as burdened by struggle, which is still a change and can still yield grief, which can be so counterintuitive to most people. It's like, well, wouldn't it make their life better? Like parents, especially, right? I think,
Yeah.
you deal with people who are probably now over 18 for the most part. Whereas, so maybe interacting with parents is not as much of a thing in your current role, but you're a child and adolescent psychiatrist in addition to being an adult and a psychiatrist. And I think that can oftentimes be a difficult thing to explain to a parent who's like, well, they
Mm,
should just feel better, or we don't understand like why they're not feeling better. And I think communicating that concept to parents, the concept of this is still a shift and there's still going to
hmm
be resistance, there's still going to be grief, and that grief can show up as acting out, it can show up as anger, it can show up as sadness, it can show up as all kinds of different things. And oftentimes parents just need to be there and make space for the emotion as opposed to, I don't know, falling prey to their own anxiety and worry, about the child, which is
hmm
so hard to do. That's a whole different conversation and not one that we necessarily have to have right now. But I just want to kind of point that out, because again, so much of the shame and stigma is not, it expands beyond just the individual student that you're dealing with, right?
Yeah. Yeah. The question of parents with the student population that I'm seeing right now, I am sort of directly interacting with parents a little bit less often
Oh,
than I used to, though still
oh yeah,
intermittently. But I would say there is a shadow of parents
yes,
constantly. The experience of, this individual who I'm seeing is still talking to their parents quite regularly. They may be 18, 19, sometimes just 16 or 17 when they start school. And so, usually thinking about treatment, thinking about what's going to show up on the insurance, thinking about having to explain, well, I'm now starting to understand that my brain works differently. Like, how do I share that with the people around me? It actually tends to be a pretty significant part of the work. So that sort of shadow of family, shadow of parents is still there quite significantly.
yeah. That's a good way to put it. A shadow of parents, because that's what came to mind, especially with I guess like the whole idea of sense of self, right? Which is that
hmm
you can't just see the individual in like a vacuum. And for anybody, again, I'm going to ask you a question about your approach because that's what we're here to discuss.
Yeah.
Because I personally respect your approach and always want to learn from
Thank
you.
you.
But just curious, in terms of, if I were a parent on the other end of the line, and I am a parent, but like, if I were talking to you and I didn't know you, I wouldn't realize how lucky I am to be talking to you. But I
Mm,
wonder, if you had to tell me about, my daughter having ADHD and associated depression and anxiety, right? And how she's not going to class and she is maybe going out more, not sleeping, drinking more, and is not doing well in school as a result. But all the parent is worried about is the school performance,
mm,
right? And you find out all these things about her past, maybe abuse she's experienced. You find all these things that could be contributing in addition to that. You know, um, you don't have to get into the details of how you explain all these diagnoses to the parent, but I
yeah.
guess, when the parent is so focused on just the academic achievement and, there's also some of their own reckoning they have to come to where they may feel like a failure. Often I hear them a lot,
hmm
right? Where they feel like a failure for having, failed their child or feeling like they failed their child, right?
Yeah.
I guess like what is your approach to that? How do you come into that conversation?
Yeah.
It's a big question.
It's a big question. I think my first approach would probably be trying as much as possible to have child and parent communicate with each other, but it might be in a facilitated way. I think very often in families and couples, these really challenging conversations, especially one where one person's challenges, one person's symptoms feel like a reflection of the other person, as you're
Mm-hmm.
saying, the sense that maybe has the parent done something wrong or the parent feels that they've done something wrong. I think it can be really helpful to have facilitated conversations in that way. So rather than me just explaining, I would probably support the student in trying to explain what their symptoms are, explain the struggle, explain how it feels to wake up in the morning and not want to get out of bed, so that the parent is maybe hearing it a little bit from the child in an environment where the child feels safe enough by my presence to share their honest feelings, to sort of break up the typical dynamic that can happen between parent and child. I think I would probably also share the ways in which I've seen this before. So, maybe contrary to what the parent says, I don't think, little Susie is lazy, even though that is something that little Susie has worried about herself. This seems to me to be characteristic of what I've seen in other people who have struggled with name whatever the illness is. And I think I would also tend to honor any, I would say maybe cultural pushback that some families may have. So if I take my own cultural background, for example, my family's originally from West Africa, from Ghana. This type of conceptualization of, for example, depression is something that's a little bit more accepted now, but really not something that was conceptualized by my parents' generation as they were growing up. And
Yeah.
I want to honor that. I think if you push back too hard against that, it leaves people extremely polarized, and it's going to be really hard for anyone to listen. So I think just acknowledging that this may not be the way that you conceptualize it, and that's okay. I suspect that there are some experiences like this that maybe you've had in the past, but you just may call it something different. Have you ever
Yeah.
experienced something like that? And trying to unite around shared experience rather than dividing around what are we going to label this, medical term are we going to use in this context?
Yeah, like shared life experience and sort of it sounds like just reframing it as a I mean they are partners, right? The parent and child have the potential to be partners in this life moving forward, especially as in the the demographic we're talking about right now is oftentimes minoritized.
Mm-hmm.
I happen to be in sense of self, it's primarily female or only female, but with you, obviously, you work with everyone, and also like yeah, just a different cultural background,
Yeah.
and coming at it with that protection. I think there's a desire to also protect a way of life, a way of
Mm-hmm.
interacting with the world that often, especially if you're an immigrant, let alone if you're just from a different culture within the States, you know what I mean? That's not the predominant majority culture. I think this idea of honoring it, as you're saying, is also not only honoring the culture itself, but also honoring kind of, yeah, the parents' desire to protect it and to maintain it. And again, this is a whole other conversation that I think you and I could probably have, which is, how much of these things that intertwine with emotional well-being and emotional
Mm.
experience become part of the culture, right? I think we both experience that, like, oh, that's just how we are. It's like,
Yeah.
no, that's how you are because of X, Y, and Z. That is not what encapsulates Ghanaian culture, Indian culture, South
Mm-hmm.
Asian culture, right? It just that's sort of what has been passed along because that's just human behavior and what you've seen. So
Yeah.
I think there can be something really healing for the whole family in that experience. To your point, no, I
Mm-hmm.
think we know there's something very healing for the whole family in that kind of experience if they're lucky enough to have that kind of experience. With you or someone like you, which makes me, wonder. There's this phrase that we use within Sense of Self as kind of one of the mottos or through lines of our work, and that is that self liberation can lead to community liberation, and our added, little precursor to that is, self exploration can lead to self liberation, which can then lead to community liberation. And I'm
Mm-hmm.
bringing that up now because what you just described in terms of this facilitated conversation you're having within family, I think is a perfect example of that phrase. And I'm just curious,
Mm.
or let's say, and I'm wondering kind of what that means to you. The idea of self exploration leading to self liberation, leading to community liberation.
Yeah. So yeah, to go back to this example of the sort of facilitated conversation with family, I think if people sort of interrogate it enough, if we allow ourselves to interrogate it enough, we'll probably see some symptoms that kind of run through generations. In child and adolescent psychiatry and in family therapy, sometimes we talk about sort of a genealogy of mental well-being or mental health and the ways in which maybe you can see that actually dad kind of struggled with attentional stuff too. He just managed it in a certain way, or that cousin dropped out of school and no one really knows why, but if you really like dig deep, maybe there was some sort of illness going on there. And so it's I think, a really hard and courageous thing to be sort of the first member in a family, or the person who really takes it far to do that self interrogation. But I think by doing that, if families sort of willing to meet the person and listen just a little bit, I think there is discovery that can come in that process. I've definitely seen parents start to sort of reflect on their own lives, reflect on their parenting. Maybe, you know, the the child that I'm seeing might be the oldest of the children, and maybe they plan on doing something a little bit different with the subsequent children who are a little bit younger. And so there is very much a ricochet effect that I think can happen, and honoring that sort of bravery and humility of that first person who decided to seek therapy or decided to investigate things, I think is an important part of the process, and something that I would want to honor in a conversation between parent and child.
Yeah, it's it can be a very tender moment, or a tender
Mm-hmm.
series of moments. It actually reminds me of the first episode that we did with the Kemi, where she at the end chats about how her parents came around, and started reading more about,
Mm-hmm.
trauma and how to deal with kids with trauma, and apologize to her kind of about, oh no, we did all this to you, we're so sorry, which could be a
Yeah,
moment
yeah,
of
I remember
humor,
that.
and connection, but is really lovely and very tender, and just, yeah, I mean, you can feel the release of tension,
Mm-hmm.
within a family structure, let alone for anybody who's heard the story, right? And hears her
Yeah.
experience. And so I think what you're talking about in terms of that same experience that you can have directly within a family can also kind of expand outwards,
Mm-hmm.
um, to people who get to who hear about this, whether it's publicly or just within friends,
Yeah, for sure.
so on and so forth. So thank you for sharing that.
Yeah.
Well, I think we've come to the end of our time. And
Yeah.
I know we didn't get into everything, but is there anything that we have not covered? There's so much more we could talk about when it comes to this topic, because, the topic of this conversation, is, what does it take for a young adult to understand themselves in the midst of
Mm.
a challenging transition? And there's so much more that we could say about that question, but I'm just curious if you have any final thoughts or things that you'd like to say.
Just very briefly, if there are any listeners or parents of young people who are about to enter a transition, I would just say that, if there's any sort of pre work, sort of preemptive acknowledgement that transitions are hard. And so if people can start to recognize, like, gosh, in the next year I'm going to be leaving home, and the next year I'm going to be entering a new environment, and maybe starting this work ahead of crisis, I think that could be, potentially really helpful if people are there.
Yeah, and a follow up to that would be, this isn't. I'm asking you for advice, which I know is a little out of scope for our conversation. But when we think about the transitions like that, because I think
Mm,
what you're also getting at is, we talked about the college transition because that was, relevant to Joy's story and relevant to your current work. But the idea of transition is can expand beyond just that, right? And oftentimes these
retirement.
principles
Yeah.
for anything, right? Retirement,
Hmm.
motherhood,
Yeah.
uh, changing a job, a breakup. Like there's the principles of transition, can be, applied, I think, in many different situations. And so, you mentioned that, the pre-work that needs to be done. And I'm just curious, just for a second, if we can dig a little deeper, into what that means to you, like what that
Yeah.
pre-work is.
Yeah. I think there's a lot of wisdom that exists in the world. I think we just don't always tap into it. It's one of the reasons I really like group therapy, because it's sort of shared community wisdom. So for me personally, in times that I've been entering transitions, I really like to read. So for example, in changing jobs, I really want to think about, like, how do I return to myself and remind myself, like, what are the things that I enjoy? What are the things that I've been missing in a current work experience, a current life experience that I want to return to, that keep me well, that keep me excited? And I ended up sort of reading books that took me through that process, or reading about other people who've gone through transition. For student mental health, for example, there are lots of books about, kids in the transition to college, that I think could be really helpful. I've not yet reached retirement. I look forward to that one day.
I love how you
But
said that. Like there's a reason you had retirement on your mind.
but I would anticipate doing something similar, like really thinking, what would like the best case scenario look like? What would I love to do? What have I been missing because I'm not retired yet? What have other people been doing? What are the pitfalls that people sometimes have during this transition process? Because it's an unstable time. It's a wobbly time. So if you sort of set up your infrastructure a little bit ahead of that, um, you may still wobble, but you may know what to reach for stability in that process.
Yeah. And for you, it sounds like reading was part of that to kind of
Hmm.
remind yourself of who you are, which oftentimes can be that, North Star
Yeah,
insight
connecting
like
to
that.
community.
Dr. Owusu, would you mind sharing a bit about your private practice and what kinds of patients you see?
Sure. So I have a practice called Anansi's Wisdom Psychiatry based out of Milton, Massachusetts, which is just a suburb of the Boston area. And I am very interested in seeing anyone who feels like navigating issues of mental health would be best served if you're also thinking about issues of identity and belonging. So that could be any mental health diagnosis. That could be anxiety, that could be depression, that could be ADHD, that could be bipolar, that could be psychosis. But how does that interact with who I am and how the world receives me? So, an example of that might be someone who feels like they've been othered throughout their life because of something related to their identity, or someone who feels like they've been separated from their cultural identity by way of immigration or adoption or foster care, and children, adolescents, and adults. So, all throughout the age spectrum.
Well, thanks. Thank you so much for being here, for sharing all this wisdom with us. I think it's really special to have heard from you today, and I learned a lot, and I'm sure others appreciate kind of your perspective and what you bring. So thanks, and thank you to everyone who listened, and we'll catch you next time.